few moments to talk about political schemes. How was the Ostrich massacre related to a dark, sinister political scheme by both governments and public health authorities alike? You see, media, once investigative and ethical, has become scripted and deceptive in a grand cover-up. The political schemes of oppressing natural immunity in favor of unsupported vaccinations has been tried in the past. In 1976, the swine flu fraudulent epidemic was initiated and vaccines were pushed on the population to replace natural immunity. But back then there was a difference. Operatives were ousted by honest investigative journalists like Mike Wallace of 60 Minutes.
But that much publicized outbreak of swine flu at Fort Dix involved only Private Lewis, who died, and those 4 other soldiers who recovered completely without the swine flu shot. The U.S. government's publicity machine was cranked into action to urge all America to protect itself against the swine flu menace.
So roll up your sleeve. Protect yourself.
And now 4,000 Americans are claiming damages from Uncle Sam amounting to $3.5 billion because of what happened when they took that shot.
One of those who did roll up her sleeve was Judy Roberts. She was perfectly healthy, an active woman, when in November of 1976, she took her shot.
By the following week, I was totally paralyzed.
Judy Roberts was a quadriplegic. The diagnosis? A neurological disorder called Guillain-Barré syndrome. The consent form was also supposed to warn people about any risks of serious complications following the shot. But did it?
No, I had never heard of any reactions other than a sore arm, fever, this sort of thing.
When the 60 Minutes segment aired and exposed the political scheme reporting on the neurologic carnage and 53 deaths, the vaccine program was halted immediately. Fast forward to 2025. Cover-up of natural immunity continues, and primarily initiated by Dr. Anthony Fauci.
Really has the flu, she definitely doesn't need a flu vaccine, because the best vaccination is to get infected yourself.
The optimal degree of protection when you get infection is to get vaccinated after infection.
And the political scheme involved creating a fraudulent pandemic based on a fraudulent PCR test. And we now know that the vast majority of positive PCR tests for COVID were in fact false. Furthermore, they created a fraudulent emergency as the only way to get an experimental genetic treatment approved and fast-tracked, because the standards would be lower for emergency authorization. And now we see the aftermath, reminiscent of 1976, except much worse. Neurological injuries, myocarditis, turbo cancer, and sudden unexplained deaths. But there's one big difference. The operatives have captured corrupt TV doctors, politicians and their government, regulators like Health Canada, FDA, and colleges of physicians and surgeons. And even some pastors took money to push the narrative. Even after 3 months of the rollout of the Pfizer vaccine in 2021, Pfizer released their own study demonstrating 1,200 deaths from the vaccine. And the media, of course, never mentioned the study. Even after 1,200 deaths, the vaccine program continued to be pushed as safe and effective. And the cover-up continues. Dr. Rancourt just published a paper of 17 countries involved in vaccination programs, and he found that consistently, excess deaths in those countries were directly related to every single rollout of the vaccine and their boosters. And he estimated at the end of the study that the vaccines may be responsible for up to 17 million excess deaths. In addition, Dr. Peter McCullough reviewed all autopsy papers of vaccine deaths for a total of 325 patients and found that the majority of patients died from either cardiac disease from myocarditis or blood disorders. And the evidence continues to roll in like a tsunami, to the point where health officials are now increasingly being called out for cover-up of correlation of vaccine and deaths. And even our own Prime Minister of Canada, Mark Carney, who once wrote a scathing report against the truckers' convoy in the Globe, continues on his scheme to deny natural immunity, including using his own agency to massacre ostriches with that immunity. So in conclusion, the culling of the ostriches was designed to cover up any potential for natural immunity, which would hurt upcoming vaccine pushes and coercions. The same principle is used for humans: fraudulent narratives, coercive tactics, cover-up by those in authority. In 1976, Mike Wallace exposed the fraudulent vaccine narrative for the swine flu by investigating and reporting on major neurological injuries and 53 deaths. And the government had no choice but to immediately halt the program. Today, we have evidence of millions of sudden deaths occurring within a short period after the vaccination. And yet, the operatives continue to push the flu and COVID shots in spite of this tsunami of evidence. And I'll leave you with this to ponder and conclude. Are the massive numbers of injuries and deaths mere negligence? Or are we observing a devious cover-up of a similar scheme as that of the massacre of the ostriches?